Thank you. I'd like to call the Health and Human Services Committee meeting to order. Madam Clerk, please call the roll.
Alderwoman Green.
Present.
Alderman Gunther.
Here.
Alderwoman Martin. Alderwoman Middlebrook. Alderwoman Rice.
Here.
Alderman Todd.
Present.
Chairwoman Ingrassia.
Present.
5 present.
Thank you very much. Let's see, our first order of business is approving the minutes from the September 14th, 2021 meeting. If you've had a chance to review them, I would entertain a motion for their approval.
So moved.
Second.
Madam Clerk, please call the roll.
Alderwoman Green.
Aye.
Alderman Gunther.
Aye.
Alderwoman Martin. Alderwoman Middlebrook. Alderwoman Rice.
Aye.
Alderman Todd.
Aye.
Chairwoman Ingrassia.
Aye.
5 ayes.
Thank you. With that, we have passed the minutes out from the September 14th meeting. Alderwoman Rice, I'm going to present Board Bill 100. I think we can get through it pretty quickly. Would you mind serving as chair since it's being introduced by me?
Sure, I can do that.
Okay.
All right, go for it.
Thank you. We have before us Board Bill 100 today. This is an ordinance recommended by the Board of E&A. It would authorize the Director of Human Services to accept a grant award in the amount of $30,000 from Washington University. And we have some speakers on that today. I know Annalisa Stover is here from the St. Louis Area Agency on Aging. I'm not sure if Valerie Russell has joined us. And then I apologize, I'm looking through my speakers list. I believe we have somebody from Washington University, Matthew Reuter. Is that how you pronounce your last name?
Reuter, but I answer to just about anything.
Okay, well, I would like to say it the way that it's supposed to be said. So I'm not sure if you all have decided how you would like to present to us, in which order, but please feel free to take over, and then Alderwoman Rice will let us know when she would like questions from the committee.
If we could, we do just need to swear everybody in as joining. So those of you who are not members of the Board of Aldermen and are testifying on this, if you could just please raise your right hand. Do you swear to tell the truth, the whole truth, and nothing but the truth?
I do.
I do.
Wonderful. Thanks. Please proceed.
Okay. I will speak first, and then Dr. Kruder is available if there are questions regarding the funding source. So good morning, everyone. My name is Annalisa Stover, and I'm the director of the St. Louis Area Agency on Aging. I'm here today. We are part of the City of St. Louis Department of Human Services. So I do want to recognize our director, Yusef Scoggin, who is with us here today. Thank you so much for allowing us to be a part of this. Thank you to the Board of Aldermen and the Health and Human Services Committee for the opportunity to speak in favor of Board Bill 100. Also, thank you, Alderwoman Ingrassia, for sponsoring the bill. Board Bill 100 requests approval to accept a grant award from Washington University Health Communication Research Laboratory in the amount of $30,000 to cover expenses incurred in the Calling Older Adult Disabled Participants to Ensure Access to Vaccines program, also known as COPE. The idea for this program originated from a conversation we had during a regional response team meeting. During the May meeting, Dr. Kruder, Kahn Family Professor of Public Health and Senior Scientist at the Health Communication Research Laboratory at the Brown School at Washington University, shared information about the $1.4 million federal grant from the National Institutes of Health Communication Engagement Alliance, known as SEAL. This grant from SEAL was received to address COVID-19 disparities. John Zakai, SLAAA's disaster response coordinator, was on the call and mentioned the work we have been doing at the St. Louis Area Agency on Aging, also known as SLAAA, to connect clients to services. Dr. Kruder mentioned that SEAL may have some funding available for outreach to the community. I suggested the idea of us reaching out to our home delivered meal clients to check on their vaccine status, and he liked the idea. He took the proposal to the university and community leadership team members for the COVID grants, and they were supportive of the effort. We began meeting weekly from there to discuss the idea of the program. As I mentioned, Dr. Kruder is here if there are questions related to the NIH funding. As stated before, I suggested having SLAAA staff reach out to our home delivered meal, also known as Meals on Wheels clients. To provide some context, here's some information about the program. Our agency currently provides Meals on Wheels to over 2,000 clients that live across the city each week. Throughout the pandemic, our senior centers have continued providing services, going to knock on clients' doors and delivering meals to our community's most vulnerable residents. Sometimes our meal deliverers are the only person our clients see. From July 1st, 2021 to October 31st, 2021, so the first quarter of this fiscal year, we delivered meals to 2,549 unduplicated clients, and we delivered a total of 168,973 meals. Our average meal client is an African-American woman in her early 70s that lives in North City, is predominantly low income, and needs the extra nutrition that the meal provides. Through the COPE program, SLAAA staff would call each of our home delivered meal clients. We would check in with them about their services, and then we would ask if they are vaccinated or would like assistance getting vaccinated. If clients would like assistance, SLAAA can then connect them with services. SLAAA can assist clients by connecting them with transportation to a vaccine clinic, or if they are homebound, by scheduling them for the homebound vaccine program. The homebound vaccine program is a collaboration between Human Services, the Health Department, and Fire EMT. Through the homebound vaccine program, currently 341 persons have been vaccinated at home. Each month after SLAAA staff have called to check on clients and to see if they would like assistance in accessing the vaccine, we would then compile the data received. SLAAA will provide Washington University with aggregated data on the client's responses. So I say that to say that no client-specific data will be shared. Washington University will assist with funding and will also analyze the aggregated data that results from the calls. I believe outreach to our clients is vitally important to improving our clients' ability to access vaccines and other services. The COPE program will allow us funding and support to make this outreach possible. Thank you for your time today and for considering a vote in favor of Board Bill 100.
Great. Is anything else, Alderwoman Ingrassia, that you would like to add, or should we just go ahead and go through the committee for questions?
Whatever your preference is, I think that Dr. Kruder was interested in maybe saying a few quick.
Oh, sure. Absolutely. Dr. Kruder, go ahead.
Back in, first of all, 26th Ward resident, tell Shamim hi when you see her. Back in March, April, and May, we worked with Dr. Eckles and others in the city, as well as health department leaders in St. Louis County and the regional response team. And we submitted a series of grant proposals to NIH and CDC to have a collaborative community academic partnership to address COVID disparities in vaccination, racial disparities in St. Louis. And we were fortunate to have all of those projects funded. And among the, many efforts that are built into those projects, one was to establish community partnerships to help agencies and organizations integrate COVID vaccination outreach into their efforts. And that's what led us to SLAAA. It made a lot of sense. The population served by SLAAA is at particular risk, elevated risk for COVID. And so getting them vaccinated and now getting them boosters is a real priority. So it just made a lot of sense for us all along as a community collaborative proposal. There were to be resources shared. The university is the fiscal agent for these grants, but it was in our plans all along to share those with agencies like SLAAA. So happy to answer any questions that folks have.
Great. We will go ahead and go through the committee here. So let's see. Alderwoman Green, do you have any questions?
No questions at this time, but thank you for coming today.
Great. Alderman Gunther.
Thank you. Thank you for being here, Annalisa and Dr. Kruger. I guess I had two questions, but I think they've been answered. The first question I was going to ask was whether this is using the outreach, the mobile outreach, which I believe you said it was. So you can, if they're homebound, you get to deliver the vaccination to them. So that was answered. The second question I was going to ask, I think Dr. Kruger just touched on, was if this is just for the first time vaccination, or if you contact someone that's already been vaccinated but needs the booster, does this include the booster? And I think you said yes, is that correct?
Yes.
Okay, so those are my two questions. Thank you very much for this. The sponsor, I would like to ask if my name can be added to this. And that'd be all. Thank you.
All right. Alderwoman Martin has not joined us. There also is a streets committee hearing at the same time here this morning, so it's a bit busy. Alderman Todd, do you have any questions?
No, I don't have any questions. Thank you for coming. I would like to have my name added as a co-sponsor too.
Great. And then Alderman Stevens, I know you're not on the committee, but did you have any questions this morning, or are you just here to observe?
No, I wanted to reference something, and you could see me sort of darting back and forth between my bookshelf and myself, but I can't find it. So I would just rather thank Annalisa and the St. Louis Area Agency on Aging, and also ask that I be added as a co-sponsor if this is the appropriate committee to do so as a non-committee member. I can also do so during our full board meeting if preferred. Thank you.
You can do it now. That's great. All right. And I don't have any direct questions either. Annalisa, I'm thrilled with this program. We've known from the beginning that outreach to our homebound population was going to be so vital here. So thank you for doing this work. Thank you for saving lives. It's really life-saving to get these vaccines out to folks. And for smartly pairing these programs together. I think it's a great job. So I would also like to be added as a co-sponsor. So if there are no further questions, we'll entertain a motion on Board Bill 100.
I'll make a motion that we pass Board Bill 100 with a due pass recommendation.
Second.
Great. Sorry, I apologize, Alderwoman Ingrassia. I didn't let you close. Did you have anything else you wanted to say? I think you're on mute at the moment.
I'll add something when we finish voting. Thank you.
Okay, sounds great. Okay, Madam Clerk, would you please call the roll?
Alderwoman Green,
Aye.
Alderman Gunther,
Aye.
Alderwoman Martin, Alderwoman Middlebrook, Alderwoman Rice,
Aye.
Alderman Todd,
Aye.
Chairwoman Ingrassia.
Aye.
5 aye votes.
All right, by the motion, we've passed out Board Bill 100 with a due pass recommendation, and I will hand the meeting back to Alderwoman Ingrassia.
Thanks for your help, Alderwoman Rice. I appreciate it. And just quickly in closing, appreciate everybody signing on as co-sponsors and really value the collaboration between departments and an outside agency here. It's really critical that we all work together, especially during the pandemic, and just really appreciate all the departments that are represented here and how much work you've been undertaking for the past year and a half, and appreciate your support. So with that, if you do not need to stay on, you're more than welcome to stay on, but feel free to carry on with your day. We are going to move forward with an introduction with our new Director of Health, Dr. Mahdi. She's just going to give a brief introduction, kind of explain her background and talk about her vision for the department, and then we'll open it up for Q&A, followed by Yusef Scoggin, who's the new head of our Human Services Department. So Dr. Mahdi, take it away.
Hello, everyone. Thank you so much for inviting me here today. It is such a pleasure to finally get the opportunity to meet with you. Alderwoman, and please stop me and correct me if I'm not addressing you correctly and with the honor that your titles and your names hold. I come from a background of medicine, and I even get a little bit, I'm really bad about even, when I'm supposed to say doctor and not, because most people can't say my last name if you've seen it. And so people take shortcuts and call me Mati. So I'm very open to feedback. But as Alderwoman Ingrassia and our distinguished chair will tell you, I reached out to her well before my start date of October 18th because of the importance of these relationships with the city. So again, thank you for having me here today. I'll just give a little bit by way of background about me and my immediate plans for the City Department of Health, and then take any questions and comments. And so I'm an immigrant from Zimbabwe, born and raised, moved to this country at 18 with the plans to just come here for my education and go home. But as things happen, you make plans and the universe laughs. And I met and fell in love with my husband, Jesse Davis, who's a pediatric hospitalist at Children's Hospital. And we now have two beautiful girls, a nanny who will be 5 in November. So the news this week is very near and dear and personal to me. And my baby girl, my pandemic baby. And anyone who had a pandemic baby knows they're built different, child, Naniso. And so she's a year and a half. I am an infectious diseases physician by training. So did my internal medicine residency at the Cleveland Clinic Lerner College of Medicine, stayed in Cleveland for 10 years, shout out to Cleveland, at University Hospital's Case Medical Center, where I did my internal medicine residency, stayed there to do some research as well as my public health degree at Case Western, and then chased my husband over here in St. Louis, where he was a resident at the time. And I came to do my infectious diseases fellowship. My mentor, who wanted to keep me in Case, tried to shame me for following a man, but I did have a ring on my finger. I was engaged at the time, so I like to think it was not ill-advised. And so I did my fellowship at Washington University, a 2-year infectious diseases, a fellowship with an additional year for HIV training and an STI dedicated fellowship as well. I started off my career with a joint contract between Washington University and the John Cochrane VA. My father is a deceased veteran of Zimbabwe who fought for our independence. And so taking care of veterans has been the absolute honor of my life and very personal. I was an instructor with WashU for 2 years and then shifted over to just working at the VA. My passion is my training and area of a specialty is around the care of people living with HIV. But my passion has always been community engagement since I started medical school in Cleveland and here in St. Louis for my entirety. I chaired the Fast Track Cities initiative and was led their steering committee from the time it was brought here to St. Louis. And that is a collaborative that brings together the mayor's office, city and county health departments, and local community groups that specialize in the care of HIV to end the HIV epidemic by 2030. So, took the call when I was asked, and now I'm only 2 weeks into this position, in this role, an absolute honor. As you know, Dr. Fred Eckles, our distinguished commissioner, has been leading the charge and has done a phenomenal job doing so, leading the city through this pandemic. I'm just particularly proud that we get to do this work together, an unprecedented duo where you have two physicians, 2 public health experts, as your director and commissioner to really see us through this time. I don't have the luxury of dealing with just one thing. My priorities right now is we're still very much in the throes of a pandemic. So that is my priority. My platform is equity. Everything I've done in community engagement up to this point reflects that. I've worked very seriously around advocating for marginalized communities, Black and Brown communities in HIV. When I saw for COVID, I beg your pardon, when I saw the disproportionate impact in our communities, and do a lot around increasing vaccine confidence in those communities. So for me, this is very much timely to have me step into this position. That has to be the charge, but I also have to prepare us for the new normal we now find ourselves in. And we've been 2 years in, we can't no longer be reactive to this, but proactive and prepare our communities for what does life with COVID look like in the long term. Additionally, there are other aspects of health. And if we continue to only focus on COVID, we do our citizens a disservice. And so I have to, in parallel, work on what we're doing with COVID and those non-COVID related issues. Highest among those for me and for the department will be trauma around gun violence in health. And Dr. Eckles has led an incredible initiative around cure violence that will continue to be a priority for us. Also mental health and behavioral health in general. This is underfunded, especially in communities of color, an area of stigmatization and a lack of real understanding and acceptance. And so this will be another priority. Sexually transmitted infections have always been an area that we have struggled with, and that will continue. But the commonality across COVID and all of these issues in health, including our chronic disease, people have high blood pressure, they still have diabetes, they still have all of these things, and we have to pay attention to that. But the unifying platform here is equity, access. We have an epidemiology department that is absolutely unbelievable, who have been keeping up with the data here. You've been getting that information that has come from this department and this epi team about how are we doing with COVID in general, but where are our marginalized populations. But the breaking news, of course, is that the FDA and the ACIP have overwhelmingly recommended that we vaccinate children above 5, and that is both safe and effective. My area of focus for this will be 2 main buckets: accessible education to our city residents, and bi-directional communications around that, and then access for our city residents. And to that effect, the city will be announcing our strategic plan for a community-based pediatric COVID rollout that centers partnerships with our FQHCs and community leaders, who really should be taking the charge if we want to make this equitable, because they've earned the trust of those communities. That centers our school leaders, and that centers our healthcare providers within the city. I have secured partnerships with some of these. Our invitations and appointments are ongoing this week, because as you can imagine, I'm only 2 weeks in, but also we have to wait for the appropriate approvals before we secure anything or give information to the public. So you will be getting that. What that will look like is, unlike adults, kids are a very specialized population, right? You cannot ask children to come to a health department building that they've never seen in their lives with people that they don't know. You can't ask them to come to the Metro Transit stop that I was on Friday that was great for adults, but is not at all a safe or comfortable environment for kids and their parents. So we need to take the vaccine to the places that they're most comfortable. Where are those places? They're the community partners that they've already been dealing with, who've earned their trust, their primary care physicians in their schools. So that's what this rollout plan will look like. We will be leaning very heavily into making sure that you are aware, the Board of Aldermen are aware, and our partners and the city in general, about where these vaccines are. And that information will be accessible starting this Friday for everybody to see what's available starting next week. But also we'll be leaning into our partners. I had a meeting with Dr. Kruder, and he was very gracious to build me in, and his ongoing relationship, the important work that he does around messaging, around equitable access and communication. And we are doing that with our other partners at our academic institutions and with our FQHCs. You will also hear plans for a work group that we will be convening, that we will ask for representation from the Board of Aldermen, as well as other stakeholders, to make sure that we're meeting bi-weekly for bi-directional information and feedback, so that we're always keeping current with the needs. And lastly, there will be a summit for our school leaders, our healthcare providers, and our FQHC leaders to get information within the next 2 weeks, and a town hall for citizens to be able to give us feedback. So I'll stop there because that's a lot to digest. I felt like a rapper trying to get as many words in a small amount of time, and I'll take any questions or comments at this time.
Thanks so much, Dr. Mahdi. Since you mentioned it, would you mind letting us know how to pronounce your last name correctly?
Oh, thanks for asking. First, you get all the grace for butchering. I butcher everybody's names, and my name is not phonetic in English, but it is pronounced Dr. Matifadza Hlatshway Davis. And because I want us to be family and comfortable, I will put the phonetic spelling in the chat, but thank you for asking.
Thank you very much. I think it looks like Alderwoman Green stepped away for a moment. Alderman Gunther, do you have any questions?
I do not. One more time though, Hlatshway.
Come on, come through with the spelling. That was fantastic, by the way. You could have sounded like you were born and raised with me. And I think a lot of people who speak other languages do a little better with me, but I'm not even kidding. That's great. My favorite pastime is when I'm on national news and they say my name incorrectly, and then my DMs are flooded with people from sub-Saharan Africa. Like, they need to learn to say your name. And I'm like, yeah. You know, it's not going to happen, but I appreciate that.
All right. Thank you very much for a very, very thorough kind of rundown on the health department. And we're really excited about having you here. The one thing I was going to ask, had been pushing the public survey that the health department put out about the future of the health department. Do you know when some of kind of that data will be brought together and sent over?
That's an excellent question, and thank you for bringing it up. Chairwoman and Alderwoman Ingrassia and I have made that a priority for our discussions, and we've been even emailing about that this week. First of all, you will be getting emails from me by way of introduction and availability. I want to make sure that the relationship with all of our aldermen, and specifically this committee, is a strong one, and there's open lines of communications, because you represent these very communities that we're trying to serve. To that effect, you know, surveys, we've struggled with surveys, right? Surveys are really difficult. They traditionally get very low turnout. And we're seeing that this time. So Chairwoman Ingrassia and my communication team are working closely together now to see how we can get that to you and get that. We want to get a little bit more time to get more feedback. Plus, as you know, disparities wise, surveys can be difficult, right? Not everybody has working internet, you know, and access to these places. So we need to work with you to make sure that we overcome some of those traditional barriers so that the communities that are most affected can answer it. So you'll be hearing more from Chairwoman Ingrassia and I after she's had a chance to sort of speak with my communications team and our Board of Health and move that forward. But that information and feedback is so important and timely since I've just started. I will tell you that I did do an exercise with my staff at the first staff meeting to talk about what are our combined missions, values, and goals. I don't believe that I should come in as a leader and dictate that. And I believe when someone new comes in, we should be re-looking at where we are with that. So you'll be seeing that combined project reflected on our website, and I'll have some comms around that soon, because I think it's important for you as our leaders to know what is really coming internally from, you know, my staff, who are the ones on the front line doing this work.
All right, wonderful. Thank you again and welcome, and really excited about having you here. Thank you.
Thank you.
Alderwoman Rice.
Thank you so much. And thank you, Dr. Matifadza Hlatshway Davis. Is that right? Okay. All right. We're gonna, the more we practice it, the more we can make sure the tongue works in the right way here. So I'm thrilled to have you on board here. Thank you so much for the really thorough rundown of all of the work that you're doing over there. We know the health department is so incredibly important for our city and so underfunded. And so thank you for the creativity that the whole department has to work with to get services to the people who need it in our city. And on the lines of vaccinations, I did just have one question: where the city is in our percentage of adults who are eligible but have been vaccinated. Do you have any idea what those numbers are right now, where we're sitting?
Yes, I don't have them directly available now. We will be sending you, I know that there's been comms between you and the mayor's office, so we'll be sending you weekly updates, and I would love feedback as to whether you would prefer a Zoom meeting like this with me, Dr. Eckles, and key members of our team as they arise. We're happy to do that. I know that happened at the beginning of the pandemic, but we're happy to bring that back, or to just send you the weekly updates. Sure. But what we are seeing is overall general, and you wanted data specifically around the vaccinations?
Yes, yeah, I'm curious about
vaccinations. So we can get that to you today even, and I don't want to give you generalities, but in general, we've seen an overall decline, much like what is mirrored in the national vaccination efforts within adults. The health department has done an amazing job, because what they have been doing consistently is making sure we keep up with zip code level data and data around our most disenfranchised communities. And then we work immediately with our community partners to try to get clinics at those sites. Having said that, we've reached the hardest to reach population, right? The population that for a year now have said, no thanks, or I'll wait. And so we're continuing to be strategic, which is where our partnership will help about what are the continuing barriers and where do we need to go. Commissioner Eckles, is there anything you'd like to add to that?
think you've covered it well. To your point, we did have regular communication with the Board of Aldermen at one point. And so it'll be nice to resume those discussions to make sure they're up to speed on what's happening in our communities on a regular basis.
Absolutely. Great. Wonderful. Thank you so much. And I do also, Dr. Eckles, want to thank you for your leadership through the pandemic and all of the work that the health department did with you and this seemingly seamless transition as we're bringing on new staff here. It's to be commended. Thank you for being a part of the team here. It takes all of us to keep our city healthy. So I think that's all I have for right now. I'm excited to continue to serve on this committee and to continue to strengthen our relationship with the health department. I know the more of us have been awake for those 8 a.m. Health and hospital meetings, Board of Health and Hospital meetings here over the last 2 years than ever before. And any ways that we can be of use, please reach out. I'm very passionate
We will.
about.
Do you have direct feedback about the comms that are most helpful? Would a meeting with us weekly be better or bi-weekly, or do you guys like the weekly sort of bulletin you've been getting from the mayor's office that I will be taking over starting Monday? How would you like those communications about COVID-related data and just brief updates on anything that I think you need to know from the health department?
Sure. I think an email is probably easiest to reach the most of us. I think getting everyone on a call is difficult. I do think that the mayor's office is planning at least monthly calls with the Board of Aldermen. And so maybe jumping on those with the mayor's office may be helpful. But I mean, I think it would be worth reaching out to the rest of the board and asking how folks would most like to participate in that, because those calls were incredibly helpful, both around COVID and then just in communication with staff about what was going on and how we could be helpful. So
okay, I'll do both because I've been wanting to say hey via email
absolutely.
to all of the Board of Aldermen. So I'll do that, but also and use that as a platform to say what would they like by way of communication, what would you all like? But I'll
Absolutely.
also reach out and make sure that I'm a part of those monthly calls. And if someone here could help facilitate that, that would be great as well.
Absolutely. Wonderful. Thank you so much.
Dr. Mahdi, if I could jump in, I just pulled up the most recent report that I have on vaccination rates. It's from a week ago, but it has the city's rate of vaccination for those ages 12 and older at 64% who've received the first dose and 56% who've received the second dose. Those numbers, as you know, vary by place and they vary by age, but those are the overall numbers, if that answers the question.
Yes, thank you so much for that, Dr. Kruder. We've been seeing a lot of variability week to week, which is why I didn't want to give you last week's before this week's. But to Dr. Kruder's point, and I love that he made that last comment in connection with that, I think we have to be careful, which is why I've actually partnered with one of our leading epidemiologists and implementation and dissemination scientists experts, Dr. Alvin Gang at Washington University, our continuing partnership with Dr. Kruder. I want to make sure that we're giving you epi that is really helpful. You know, Dr. Kruder will tell you, you can report any numbers at any time, right? But what's actually helpful and helps to lead policy and inform decision-making is critically important. So we will be in communications about how that's being looked at as well. So thank you for that, Dr. Kruder.
Wonderful. Thank you.
And Dr. Mahdi, I'll make sure to touch base with Michelle so that you are in connection with the mayor's office regarding the monthly calls. They seem to have been on Thursdays at 4.
Okay. Listen, if it's coming from the mayor's office, it doesn't matter what's on my calendar, I'll make it happen. So I appreciate that, Chairwoman Ingrassia. She's my boss and we want that first performance review to go well. You know what I'm saying?
Fair enough. Alderman Todd, do you have any questions?
No, I just want to thank Dr. Mahdi and also Dr. Eckles for staying on as commissioner. And thank you very much.
Alderman
Thank you so much, Alderman Todd. I really appreciate those words. I also appreciate him staying on. It means a lot to me, trust me.
Alderman Stevens, did you have any questions?
No, I would like to say I'm so delighted to hear that you are from Zimbabwe, Dr. Here we go. Hlatshway.
I mean, what is going on? Okay, this committee takes the lead. I've never had people say my name this well. I'm just used to it being butchered, so I appreciate it.
Well, I appreciate that because I study linguistics, specifically historical linguistics.
There it goes.
And indeed, I, prior to being elected to office, pursued the Foreign Service with an interest in going to the US Embassy in Harare, Zimbabwe. So on behalf of the 12th Ward, and if I may be so bold, on behalf of the Board of Aldermen, I wanted to say Mauia to you, to this new role. Assuming, of course, that you're in the 70% that speaks Shona or familiar with it. So again, you have just given me such a beautiful gift in allowing me to indulge.
That means so much to me. And don't you make me cry on a public forum now. Come on, we're not going to do that. But you know, people forget I speak a second language every day and I don't get opportunities to really connect with my culture. So it just means so much to me that you'd even make space for that. In my culture, when women thank, we do so by going like this and saying Tino Tenda. And when men do, they cup their hands like this. So I just want to say thank you for that. That meant a lot.
Well, and likewise, Tino Tenda to you, Dr. Hlatshway, rather. I did want to ask, as I asked Director Scoggin earlier, I always want to put in that long O. Did you receive a note from my office welcoming you to your new position, or?
Listen, Alderman Stevens, I wanted to tell you, when you asked him that, I was in my feelings because you didn't ask me. And since he's gotten here, he has scooped me as the favorite everywhere. We walk into the mayor's office together and it's, hey, Dr. Mahdi. Oh, Yusef. So anyway, I was in my feelings, but I just decided to swallow it. But thank you for bringing that up. I did not, but it's good to know that you thought of me too, because let me tell you something. It's hard. It's just hard existing in his shadow. It really is. It's appropriate because he's a rock star, but it's still hard.
Well, for what it's worth, Doctor, I wrote yours first. And I will ensure in the future that that they are properly routed. And that's
you so much. You've all made both of us, I think I can speak on behalf of Yusef, but you've all made us feel so welcome. So please don't worry about those formal channels, but we do appreciate it.
Well, good, because I speak much better than I write. My handwriting is atrocious, so it's better to hear it anyway. But otherwise, I wanted to thank you for bringing your culture with you, and for having that space as well, and for allowing us to make space for it, but also for coming into this position during a now 3-year pandemic. And as a new mother, my goodness gracious, that is not an easy task for anyone. And I just wanted to thank you for your diligence, for your service, and for the service that you will continue to provide to our city. And I look forward to those meetings that Alderwoman Rice and Alderwoman Ingrassia, or Chairwoman Ingrassia, apologies, spoke to. And I look forward to future collaborations. So.
Thank you so much. That means a lot to me. And thank you for making space for immigrant culture. That's an area that Dr. Eckles is really focused on in his leadership role, making sure that our immigrant populations are also brought to the table, and they're often left out of these conversations when we're talking about equity. So thank you for making space for that. I think it's important to have representation, but also for us to be clear about the unique challenges they face, right, in disparities and overcoming those barriers. So I think that's really important. Thank you.
All right, I know you're on a time crunch, so could you quickly let us know what we can expect and how we can help direct residents between the ages of 5 and 11 to vaccines? It seems like they are available possibly this weekend.
Yeah, so all of our partners have already started convening appointments, and we will have those available on the city's website by Friday. Please reach out to me if you're having difficulties accessing that or seeing that. We'll be updating that on a week-to-week basis to make sure it's current, but you have to bear with us, right? A lot of those change on a day-to-day basis, and we'll be doing the best we can to keep up with that, but we will be driving the comms for that and making sure that those access points for the city are current. Like I said, the priority here is access, so they can still reach out to the areas that they're most comfortable with, right? That should be your primary care physician, your school district, and also your community leaders. But for many of our communities, those pinpoints aren't there. So the reason why I've already reached out to Chairwoman Ingrassia around the need for representation on our work group, that's going to be the first ask that you'll see from us. And she has graciously accepted the charge to be one of our representatives, but we need people, especially from our most underrepresented zip codes, and you'll be getting communications about that. Any assistance that you can give us around our town halls and summits will be really key. But as far as access to the vaccines that will be available on our websites, we will have communications out to you. And I'll keep those, if it's helpful, on our weekly comms. starting next week, I'll also make sure there's a section there so that you can see what's happening on a week-to-week basis around the city and where people can access those.
Excellent. Thank you so much. And as I've mentioned, let this committee know how we can support you in your department. I don't know if you've noticed, this is, if not one of the best committees, the best committee on the Board of Aldermen. All of us like to work and work in collaboration well and like to put in the time. So let us know how we can help.
Thank you so much. You're not going to get me in trouble with agreeing with the other elder people because I need them to, you know, I can't start off on a bad note, but all I'm going to say is,
yeah. Have a great day. Thanks so much for your time.
thank you, everybody.
All right, Yusef, you ready?
I am.
All right, thanks. Yeah, just go ahead and brief background introduction, and then whatever you want to share in terms of your vision and how this committee can help you.
So yeah, I just want to again thank everyone for the warm welcome that I've received prior to taking the position. As many of us have discussed various matters relating to the unhoused and the housing unstable throughout the region over quite some time. So I just want to really thank you for that. And again, the opportunity to share with you all on my 11th day in. I'm not sure if there are any casino goers, but 11 days and 11 is a lucky number. So here we go. I'll just give you a little bit of my background. I have a medical background as well, but I'm a St. Louisan to start. Okay, I grew up in St. Louis County through 8th grade. And I moved to the city for high school. And for anybody who is concerned about which high school I went to, it was Metro, the best public school in the state, essentially. And so I grew up here. I've spent quite a bit of time really learning our community. My family grew up in the Ville area, so there are deep roots there. And so I eventually went on to undergrad at Xavier University in New Orleans, did medical school at Mizzou, and then came back here and started doing some research over at the hospital. And so many will ask the question, well, how does a physician transfer into human service work? Well, back then when I was doing research, and it was with sickle cell patients, pediatric sickle cell patients, what I was noticing that a significant number of patients on my protocol were returning and weren't doing all that well. And under further investigation, was able to determine that they were returning to environments that really weren't conducive for their wellness. And so when I coupled that with a second love of mine, all of my uncles on my maternal side are in construction, and I love renovating homes in the side. So if you all see me in a pickup truck with a zero turn and some weed whackers on the back, don't be surprised. I kind of connected that, okay, this first house I did in medical school, my sister is a physician as well. And so, but she actually does anesthesia in New York. And so we bought our first home in med school, renovated that. And when I came back to St. Louis and was doing the research and kind of got more involved in community, I started to understand that a house is only one component. Nice kitchens and baths mean one thing, but overall community mean a lot more. And the amenities and the community involvement, organization, et cetera, really matter. And so I was trying to understand how could I be of more impact in keeping people out of the hospital, in trying to sort of put my collective interest in addressing some of the human service needs out in the community. And so I found myself kind of veering into this lane for the last 5 years or so. I've worked in St. Louis County up until the day before I started with the city, so no time off, because there's an urgency of the time, and I'll go into that in just a moment. But while at St. Louis County, I had the opportunity to serve in a number of capacities. One thing I would say is human services is hard work. I think many of you all recognize that. It's very hard work. It can burn folks out, and folks within this space are often underpaid. And so when I arrived in the county, there was one staff person in the homeless services division in particular. And so we have to really build out a team, change the narrative, build out a continuum of care, partnerships that could really support how we could leverage government and private and other partners to move things forward. And that built a whole host of things. One being that we were able to maximize the utilization of federal funds, but also be very creative about the use of our local funding sources, which allowed for us to reduce the number of folks who were on the streets. We had the lowest percentage of unsheltered individuals in the state. When we do our annual point in time count, less than 5% of those who were counted on the point in time count day were unsheltered. And for all individuals who were unsheltered, there was placement available for them. That was a critical piece. One of the pieces was the recognition that shelter is but one component of the services that we provide. And so we have to have other pieces that ultimately lead to permanent housing. And that's really the ultimate destination for folks. But one of the challenges within our region is that we're very segregated, and many of the issues in St. Louis County center around that as well. And it is really codified currently by the capitalistic elements around affordability. And so in two task force that was established in the county of which I was on that and helped to support a 17-member group. My internet is unstable. Can you all still hear me? Okay. And there was a 17-member organization that came together to sort of study affordable housing trust funds across the country. St. Louis County did not have one. We were able to establish one the following year, subject to the task force report. Funding still needs to be codified to really support the changes that could happen there in the county. But that was one piece of it. Subsequent to that, all of these resources, local and federal, could be supported to really drive forward in a different direction for housing within the county. And so fast forward that to this pandemic. The beginning of the pandemic was, I think, a recognition for all that what affects folks east of Skinker also affects those west of Skinker. And how could we come together? And so in serving as the chair of the St. Louis Area Regional Commission on Homelessness, I've had an opportunity of connecting and partnering with continual care throughout the region. That includes both city, county, St. Charles, and Illinois. That has been in place for the last 4 years now, and has led to initiatives around reduction of homelessness amongst the veteran population. And during this pandemic, was able to support through the only quarantine and isolation spot in the region as operated through our office. So we were able to quarantine and isolate those who were impacted by COVID-19, who were unhoused. We served over 250 individuals throughout the region by partnering with health departments, federally qualified health centers, as well as hospitals to ensure that those who were unhoused were not out in the community without a place to stay, without a place to recover. As a result, we didn't have anyone die from COVID-19 that was unhoused that we had in our care, and that was important. Additionally, we didn't have situations in which we had unhoused individuals who, particularly in the cold, if they are symptomatic and you ask them, oh, do you have any of the symptoms related to COVID? What is the likelihood that they're going to tell you that if they don't have another option of where to stay? And so having this as an option helped to also protect our overall shelter and other systems. There's a lot behind that also was able to flag individuals who we knew were of concern and had tested positive so as to redirect them during that time. So that's been a key element of the work over this period of time as well. And so coming here to the city is multifold. We are also deploying emergency rental assistance dollars that are critical to housing stability. So when we think about homelessness, oftentimes many only think through the lens of those who are literally on the streets. That is one component. But how do we stop the pipeline of folks into hardship? And whether that is seniors, that is youth, or that is the folks that are disabled, or those who are unhoused. And so what I am focused on as a serious priority is really making sure that we are a data-driven department, that we are really collectively working with all partners to support the needs of folks going forward. We are not in competition with nonprofit organizations. We are a data-driven entity that can help to direct and coalesce and convene parties that are necessary to really execute on this work. There is a lot to tackle within the city of St. Louis. We have a disproportionate share of the unhoused, disproportionate share of those who are suffering financial and other hardships, and trying to make sure that we pull together intergovernmental partnerships to make sure that workforce is connected to many of ours who are unhoused, health department related issues to make sure that people are getting adequate care. If you are unhoused, your life expectancy is severely diminished. As you may know, the disproportionate population of those who are unhoused in the city of St. Louis, as well as throughout the country, are people of color. And so we have to think about what are the driving forces behind that and how do we attack that. So I'm happy that we'll be working with community development as well as the Affordable Housing Trust Fund on a variety of things to move this forward. So those are our big issues. What's coming soon is obviously the ARPA funds. We are currently looking through over 55 proposals that have been submitted. Subject to that, those proposals were due about a week and a half ago. And so we're looking forward to making sure that we first prioritize those proposals that would help us support the needs of those, particularly during inclement weather. Big picture, I know I'm focusing a lot on the unhoused because that will be a major issue over the next several months in particular. But one of the issues that I have with our overall service model is the idea that our sheltering services are primarily a nighttime service, not a 24-hour service. That is counterproductive to, I think, wellness and connection with those involved, as well as it creates systems that cycle our services in an efficient way, such as if you are an unhoused individual, but you can't get into shelter until 5 or 6 o'clock in the evening, you're eating and then you're going to sleep. You wake up in the morning, you're leaving the shelter at 6 or 7 o'clock in the morning. I'm trying to figure out when is the time for someone to work with you, discuss your challenges, and ultimately support you to a permanent housing destination. That model must change. And so that's going to be a major component of the work, is changing that model. Another thing is making sure that people have the well-rounded resources that would ultimately support them. And that means partnering with behavioral health community in significant ways, creating housing that accommodates those who are the most challenged to support. And so we're looking forward to doing all of those things within a relatively short order. We have a tremendous opportunity before us with all the resources that are available, but we cannot let this moment pass and squander this opportunity. And so really reviewing proposals and making sure that we are executing on value adds to this system are key. So that's part of the narrative for what we'll be doing moving forward. I am also a 26th Ward resident, Dr. Kruder, and I see our alderperson, Shamim, is on the call as well. And so I'm proud to be a part of the Mighty 26, as it is I think, a beacon of hope for what our community can be as we deal with issues around segregation, the Delmar divide, and the like, and all of which contributes to some of the challenges that continue to plague us. There's a beautiful story being written in the 26th Ward, and I think there'll be a beautiful story written about the city of St. Louis as we move forward. So I will say that one last thing is we have our Hunger and Homeless Awareness Month. And I'm not sure if there's been much with this committee that's been done in the past relative to that week, but we'll be working with the Continuum of Care, the St. Louis Regional Commission on Homelessness, to also support that, as awareness of this issue is important. One of the reasons I came at this specific time was to make sure that our emergency rental assistance dollars also were directed accordingly. You may have noticed media attention being paid over the last several months. Congresswoman Bush certainly went out onto the Capitol steps to protest the expiration of the moratorium on evictions. And there was bad press around what communities were doing in terms of the deployment of those resources. So the way that we operated dollars, both city and county, under the CARES funds were helpful, but I think they taught us a lot. And so that then pushed us in the county to pivot of how we were going to execute on the ERAP fund. So what that meant was we were going to have more of a centralized way of doing it, where we could track data, we could understand what was happening, we could look at turnaround times, and we could pivot as necessary to execute. That has led to a 92% spend down of the resources to date, one of the highest in the state. And so we were able to, just before I left, put together an RFP through many conversations with the city of St. Louis and the county to ensure that a joint operation would be executed on for the second round of emergency rental assistance. All proposals for that program are due back on November the 15th, with an anticipated launch of that program for the first week of December. That should improve our overall turnaround times and reduce the number of folks who are being evicted. We can execute on these, but we need to utilize nonprofit organizations in the way that they are most skilled, and that is with case management, working with households directly. But vetting applications and actually cutting checks is not necessarily always within their best suited expertise. And so we look forward to great things coming from that and supporting the households so that we can reduce the number of folks who are being displaced. With that being said, I think that's generally all I wanted to share this morning. I know all of pretty much everyone on the call. I hadn't met Alderperson Gunther and Stevens, but everyone else on the call I've met and conversed with pretty much in the past. And I'm happy to be here working in the city on some of these tough issues. It's not going to be without some bumps in the road, as there are some historical and other system level challenges. There are some serious challenges with relationships between the continuum of care. I am very keenly aware of that. And so we're going to repair those because they are fundamental to us executing on an agreed upon outcome for the people that we serve. It does no one any good to be fighting. Our community demands better and needs better. And so we need to work together in order to achieve that.
Thank you so much. Before I forget, did you say that you are a physician?
Yes.
Holy cow. That makes me jealous because I'm the kind of person who's good at one thing and apparently you're good at everything. So should we be calling you Dr. Scoggin?
Yusef is fine. Either way is fine with me.
Okay.
Yeah.
All right. I'll pass it off to the committee. Alderman Gunther, do you have any questions?
Okay, there we go. I guess once again, just welcome. Look forward to working with you. Also very passionate about some of our unhoused issues, so I look to collaborate with you on that. My only question was, I know 4 years ago, one of the things that when I first got elected, there was a lot of questions about the 24-hour shelters in the city and like just walk-in availability for shelters. And I think I heard you say that you want to try to get away from that sort of model, which I understand because it's important to be able to have people check in and actually be able to help them with some of the services available. But is there any chance of doing a walk-in shelters in the city in the future?
Yeah, just for clarification, I was indicating I wanted to get away from just nighttime shelters.
Okay.
We wanted to focus on shelters that provide comprehensive 24-hour services with case management. And that would lead to better outcomes. Our data shows us that when you are able to build relationships, particularly with the chronically unhoused, you're able to lead to better outcomes. And so that's kind of where I was going with that. But to your secondary part of your question, all options are on the table. The city is engaged in something I think that is really ideal, and that is the tiny home transitional development. Just looking at some of the data behind that, 50 tiny homes there and over 125 individuals served year to date, with 70 or more % of those individuals exiting the permanent situations. And so we, again, want to look at each option, determine its utility, particularly with certain subsets of the population, to determine that nothing is off the table. We just have to calibrate it correctly and make sure it is applied in an equitable way.
Okay, thank you so much for that clarification, because that is something that I would love to be able to assist with. So that's my only question. I'll yield the floor.
Alderwoman Rice.
Thank you. And thank you, Dr. Yusef Scoggin. I also did not know that you were a physician. So joining Alderwoman Ingrassia in my just immense admiration for you and the work that you did in the county. And especially, these last 2 years that we've gotten to know each other as we've been, working to try to find solutions here. I am incredibly impressed and I am incredibly encouraged and hopeful with the perspective and the passion and the experience that you bring to this role. Got me a little emotional about it, honestly, because we have so desperately needed your type of leadership in serving this incredibly vulnerable population. And it is a citywide, it is a region-wide problem that you have been able to work with. And so thank you for providing shelter for folks who needed COVID isolation over this last year. That's something that we've been trying to talk about it and tell folks about that didn't know that you were able to stand that up in the county, and that was life-saving for our unhoused neighbors. And I just, anything that we can do to be useful to you as you are navigating this new space and working to remove barriers and working to connect with all of these partners, please let us know. Like Alderwoman, like Chairwoman Ingrassia mentioned earlier, this committee likes to work. We are here to work with you. We are excited to work alongside you as we work for the best for our neighbors. So thank you again. Thank you for making the jump into the city. We deeply appreciate you.
I appreciate your words. Thank you, Alderman Rice.
Alderman Todd.
First of all, thank you, Dr. Scoggins, and I've had the honor of meeting you, and I've known your father. We had the opportunity to work with him many years ago, so you're following in his footsteps in the service in field of looking out for the most vulnerable. And I loved your presentation again. Our city is honored to have you working with us, and thank you again for coming to the city. I don't have any questions.
Thank you, Alderman.
Alderman Todd.
Alderwoman Evans, I saw you joined us. Do you have any questions for Dr. Scoggin?
No, not at this time. I'm just glad to sit in and hear some of the things that are taking place, especially involving the unhoused in our area, because I know we do have future tiny homes to accompany unhoused vets. So I'm just glad to see that this situation has the attention and things are happening positively for it.
Thank you, Alderwoman. Alderman Stevens, any questions?
Yes, I do have a quick question, actually. Director Yusef, would that be a suitable compromise on my need for formality and whatnot? Could you speak more to, just very briefly, the tiny homes success rate here in St. Louis? I believe you said that there's about a 70% permanent placement after leaving the program. Is that correct?
That's correct. That's correct.
Okay. I'm sorry.
Yeah, so, obviously, this is the first of its kind in the region. The tiny home development, we call it Jefferson Spaces, being managed there by an on-site Magdala Foundation. And that development was put in place late December. So we're really kind of looking at data from January of this year forward. 125 individuals have been serviced there. And so there are 50 units. Of the 50, 42 are single person units, 8 are 2-person units. And so these obviously have turned over a time or so. And so the average stay for those that are there ranges from about 3 to 6 months until they're exited to other permanent housing destinations. And so about 70% have exited to permanent housing destinations. The other 30% continues to be worked with to sort of support what their challenges are and get them redirected into permanent housing destinations. And you compare that to a lot of the shelters, right? So shelters oftentimes, again, as often a focus of those when they think of homeless services, shelter exit destinations often are less than 50% to a permanent destination of any sort. Many permanent destinations from shelter often involve family reunification, which often is important and is a contributor to a good success story. But it just is one additional option when we're thinking about servicing folks in a short window of time. In their own space, might I also add that it was a COVID safe opportunity as well. As we know, the congregate sheltering situation serves as a potential risk for virus transmission.
Well, I mean, I'm blown away, frankly, I think those are incredible stats. That we're collecting stats from January 2021 to November 2021, so not even a full year. Already 125 individuals have gone through the program, who 70% after 3 to 6 months have made it into a more permanent housing situation, and the remaining 30% are still receiving services. I knew it was successful. I didn't realize it was that successful. So as an alderman who has very recently worked with Tent Mission STL in both the District 1 and the 1st and 2nd District police precincts to stabilize a trio of unhoused neighbors here in Ward 12 who are trying to get into this program. That's very reassuring. And I want to both thank you and also acknowledge and praise your effortless work in your language. To go back to my studies as someone who studies linguistics, in reframing the conversation of how we humanize, or rather how our language dehumanizes the unhoused community. That is an uphill battle that I face in my ward. They are not the homeless. They are unhoused or homeless citizens. They are unhoused neighbors. They are still civilians. And I, as a member of the LGBT community, I do not like that article, the homeless community or the LGBT community. It is our homeless community. It is just our community, frankly. And that's just one of my little linguistic rants. But I caught that in your speech. I appreciate that. That is also reassuring because it is the proper mentality. It is a humanist mentality. And I mean, now more than ever, you and Dr. Hlatshway as well are so desperately needed in our city. So I appreciate you. I'm very happy for both you and our city. And for our tiny homes program, I'm blown away, Chairwoman Ingrassia. Chairwoman Ingrassia is like the biggest fan of tiny homes, and now I understand why. So with that, I will relent back and thank you.
Sure. Looks like Alderwoman Rice might have a follow-up question.
I did actually. Thank you so much, Chairwoman. Dr. Yusef, I did have a question. So specifically the tiny homes that you're referring to are the ones that are on the St. Louis RV lot there on Jefferson, are those ones? Okay. So it was my understanding that after that facility was opened, people who were residing there were required to have employment in order to get into those spaces. Could you talk about whether that is still the case or if that requirement has been changed?
Yeah, I'm looking at some of those pieces. I know that there were sort of screening criteria around home plans sort of already being in the works or some sort of pathway to stability. And so with it having been operated for now more than 9 months, what I want to do is look deeper into the data to determine what is the utility of certain screening mechanisms and the staff's ability to work with a broader population. And maybe we may tease that into it over time, because not everyone is going to fit the criteria that you suggested.
Yeah. Okay.
And those are the most vulnerable folks, right?
Right.
And so I think that's another piece to the work is screening out folks is not what we should be doing. We should be thinking about how do our systems respond to the needs, however folks present themselves.
Absolutely. Yes.
Is come as you are. Right.
Yeah, absolutely. Thank you for that. And I'm glad to know that it has been successful. There have been some questions on, how what the occupancy of those available units has been, if they were fully occupied or if there was space that more folks could be utilizing. And so I think that's one, maybe a chairwoman, that we could have a continuing conversation about what that looks like. And so if that is a successful model that we can then expand further into the city, having that data would be really important. And also just I know that there have been continuing conversations about what happens when someone is banned from a particular shelter or a particular space and then being banned from all of them. And I know that that's something that you're conscious of, that we make sure that we are removing as many barriers as possible to get folks off our streets as the temperatures drop, and keep people safe within our shelters and out on the street. So thank you so much for that.
All right. Well, just thanks again for spending time with us today. You obviously have a fan club here, so put us to work, and let us know how we can support you moving forward.
Point in time count is coming January, last Thursday of the month, I believe. It's not confirmed, but I think it's going to be January the 27th. There'll be a lot of information being shared over the next probably 4 weeks as ARPA funding opportunities are being discussed, that will run the gamut of service types. And to Alderman Stevens' point earlier, our office, our community owns this problem. This is our problem. This is our people. And so we need to respond and make sure that the funding that's in our hand is available to address the needs that they're expressing.
Great, thanks again. We will move on the agenda. Does anyone have any announcements? If not, then Madam Clerk, please excuse Alderwoman Martin and Alderwoman Middlebrook for necessary absence. And I would entertain a motion to adjourn.
So moved.
Second.
All in favor, signify by saying aye.
Aye.
All opposed? All right, thanks everybody. Have a great day.
Thank you, everyone. Thanks, Chairwoman.